Hi, and welcome to our broadcast, The Path to Be Well, a knowledge and learning session. To all our listeners, we're so happy that you've joined us. Also note that you can also subscribe on our YouTube channel or find us at weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option, whether or not it's right for you, and will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do us and them a favor by sharing this event. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, now Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded it just wasn't for me. I will admit I did find myself judging those who did consume marijuana, thinking their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I did witness firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So today being Thursday, I am happy to have my colleague Paul Calori join me today. And Paul, welcome. And what's on store for today?
Thanks, Mark. How are you today?
I'm doing great. How are you?
Oh, I'm excellent. Thank you. On store for today is ingestion, or eating your cannabis as a method of consumption. And ingestion, it's an interesting one because certainly just even the time that I've been, we'll say, involved in the industry, this is something that has had a huge evolution. And I can only imagine from 2013 where you joined, but we had experiences with clients coming in that were looking to make their own cannabis edibles. And now we have an entire industry dedicated, at least in Canada, and there, other jurisdictions as well, dedicated to cannabis edibles. And so ingestion, or eating your medicine, we're going to cover kind of two topics, or two subtopics in that area. And one is capsules or gel caps, which are generally cannabis little specific doses, 2.5 milligrams, 10 milligrams, 5 milligrams, but it's a little gel cap filled with cannabis extract or oil as a dose that way, and then cannabis edibles. And those are your food or drink products. So we often relate that to sweets. We think brownies, cannabis gummy bears, and they're specifically dosed as well, be it 2 milligrams, 3 milligrams, 5 milligrams, what have you. But just before we go further than that, Mark, do you want to add in a little bit about previous experiences? And we talked about homemade, which is really for a time there the only way to have an edible in the cannabis space.
Yeah, absolutely, Paul. In fact, as you were speaking, I'm thinking, wow, how this industry has evolved over time. So think back, not that many years ago, 3-4 years ago, where someone coming to see us that did not want to smoke a joint or a bong, or even reluctant with vaporizing, there weren't that many options. Now, some of them were actually making smoothies and those sorts of things. But others were, I think the common one that I've heard of is brownies, because you can go to a store and buy a $2 box brownie mix. So it's pretty easy that way. What I've seen and heard is some of the challenges with that is to making it consistent. So it's very important to measure your ingredients up front. Now, if it's a premix, that's always going to be constant, or should be constant if you're buying the same product. So, of course, more importantly is the cannabis. Now, there's variables. You know, what is the cannabis that you're utilizing? What is the potency and the makeup of the genetics of that plant? So if you can kind of hone in on that and keep that part consistent, then it's all about measurement, right? So for call it an 8x11 pan, and correct me if the terminology is not right. I don't spend much time in the kitchen doing that kind of stuff. But assuming that those are constant, and then you measure, you know, your dry flour, you grind this using, say, a coffee grinder is one example of that. Some decarboxylate ahead of time before mixing it. There's different views on that. Others will say, why do you do that if you're going to bake it anyway? So I'm not an expert. I'm just sharing kind of what I've seen and heard. So it's to be constant in that. And I've also heard where some are saying, well, I don't want to eat 3 brownies before going to bed to help me sleep, because it's kind of counterintuitive with the amount of chocolate and the sweets that's in the brownie. So a good idea, a good approach there would be to make your batch, call it your recipe, more THC potent, so that you're using, you know, maybe a sliver of a brownie. And you'll have to experiment with this. And I'm sure you'll have some good cautionary notes to share with our audience about that, and some potential risk. Now, I want to say this. If you're like me, and the few times that you're in the kitchen when some baking is being done, I will quickly reach for the spoon that was used to mix the ingredients, or just before washing it, and not wasting anything and licking it. So if you are not the one that's going to consume this, just keep that in mind, that you may not want to reach for that spoon that's been used to mix this. Over to you, Paul.
Yep, that would be an accident, maybe. Good explanation on the homemade edibles, Mark, and we'll kind of leave that discussion there. And now we'll just go more focused to what you might find in government stores, or the legally grown and packaged and that sector of cannabis edibles. And so one of the things right away is standardized dose. And so, as I mentioned on my intro, is you'll find the package, the brownie package, it has 5 milligrams in there, or the gummy bear is 2, but they're set doses, and it becomes in a dosing way. If you're used to a certain amount, it becomes difficult. Certainly in gel caps, you can't cut them open and take half now and half later. And so these are, we know people use them, but they tend to be, we'll say, second or third step along their cannabis dosing journey. We often recommend sublingual dosing, or dosing underneath the tongue, to get used to, you know, I'm going to take 10 milligrams per dose. Well, as soon as you have that set in mind with your therapeutic effects, you can transition into something with a set dose of 10 milligrams, because you know what that's, or you have an expectation of what's going to happen when you take that. And so cannabis edibles or capsules, gel caps, take a little while to take effect, 90 minutes, 2 hours, sometimes even longer, especially with the food products. But they do last 6, 8, sometimes even 10 hours. And so these tend to be excellent for dosing for long-term conditions. What I mean by long-term, maybe not the proper terminology, but conditions that you experience the symptoms most or all of the day. And so we think of the most common one that we see, chronic pain. Chronic pain tends to be there in some level, high level, medium level, or low intensity level, but it tends to be there during most or all of the day. And treating with a medicine that lasts over 6 or 8 hours can be beneficial. Do you have anything or want to add anything to that, Mark?
Yeah, as you're speaking again, some thoughts that come to mind is if you're going to be out for the day, for example, and that may not lend itself well for medicating while you're out. And of course, not being under the influence. I'm speaking CBD primarily here, is that an edible, even taking it with you, but taking it before you go home or before you leave your home, would give you a long time or long coverage time. And then if you required more hours later, that it's discreet, it's easy to medicate that way. So it's very convenient for the numbers you've said, for the reasons you've said, rather, that it will last a long time, and also very discreet, easy to wrap a little gummy, and keep that in your purse or in your pocket.
So, I touched on the one condition there, pain. Sometimes we see people looking to treat anxiety. That's kind of there all the time. And what I like to describe is the long-acting medicine. We tend to see people trying to keep themselves on a tighter wavelength. And what I mean by that is those of you that experience anxiety, you know that your highs can be maybe a little too high, we'll say, but your lows is where you really notice them down. And it's same with depression. And so long-acting medicine can help tighten that up, where you find you're not drifting too much up or too much down. And we do see clients that have come through and explained to us exactly that with that long-acting medicine.
Mm-hmm. Yeah. And although it's not ingestion method, but as you're speaking that, so I can see that where a patient is now setting, call it a baseline, so to avoid those peaks and valleys throughout the day, and as required, perhaps if they needed to add a little bit more to that, then perhaps a different method would be good to top it up, so to speak. And I know that's not the topic today, but I just thought I'd throw that in there to show that they can work in tandem together and collaboratively, the various methods.
Absolutely. And it's what you're really saying is it's not an all or none. So if I choose to ingest and eat my medicine, I like the taste, whatever the reason is that you got to that point, it doesn't exclude all the other methods of the 4 main methods of consumption. It doesn't exclude. It can be very complementary, as you've just suggested. Now, I think there needs to be a discussion about cautions with regards to edibles. And it starts with what I mentioned with legal source. So there's been studies done that have shown, we'll say, gray market or not regulated sources in some of these products aren't what is on the package. And some people thinking they're getting CBD products, actually, they've tested the products and found THC in them. Studies have done this. And so, this is really across the board and something we've always promoted. Go to a regulated source to ensure what's on the label is in the product. And just as importantly, what shouldn't be in that product that can make you sick or ill and have adverse effects isn't there. Mm-hmm. Okay. And so once you get to the point of the cannabis edible, I think to some degree, one of the issues is they look benign. It's a brownie. It's a drink. It can't do anything to me. And in fact, in areas where edibles have been legal for, let's say, longer periods of time than in Canada, where we're at, where it's relatively new, it's been shown that the emergency room visits, most often having to do with cannabis, have to do with the edibles. And here's why. It's in the case of THC, and it tends to be overconsumption, and where you get the effects of extreme euphoria or even psychosis. So the person sits down, whether they're medicating or if you're in an area that has adult use, and they consume a brownie, let's say, and they wait an hour, and maybe some people around them, or just they think they're at the point where they should be feeling something of this medication, and they don't feel it. And they wait a little bit longer, and now it's 90 minutes, and they're still waiting for that effect to start happening. And then they say, maybe I should try another one. Maybe I did it wrong, or whatever the case may be. And just as the second one's consumed, you start getting the effects of the first one, and the second one's now in your system, so it's going to produce more effects. So you kind of get a doubling up, if you will. It's a bad analogy, but you get what I'm saying, where you get the extremes. And it can be a really, really rough period of time, because we've already talked about it can last 6 hours, 7 hours, 8 hours. If you see this happen to someone, they very well, may need medical attention. But the simplest thing, as is always the case, is prevention. And so, especially if you're new to cannabis edibles, you're trying it for the first time, if I can caution you, or you take anything from this lesson today, only do one on the first time. And if it wasn't exactly it, you can fix that the next time that you go to medicate, the next time that you use a cannabis edible, and adjust accordingly. I had too little, so I'll take a little bit more. And we always say start low and go slow, right, Mark? Mm-hmm. And so this applies to the edible as well, because once it's in your system, it's going to last a long time, and you don't want a negative experience when you're trying to medicate.
Mm-hmm. Yeah, Paul, in a adult use setting, there's so many unknowns, right? What is the potency of the cannabis that's in the brownie or whatever edible form that is available, and what's the concentration? So there's so many variables. I would personally rather, if I was one of those that would consume that, I would probably, prefer to refrain from that for those reasons, because you have no idea what's in there. But if you do feel inclined to do that, proceed with caution, small amount. And I know for me, if you have a sweet tooth like me, you would want to overindulge, and of course that would be a no-no, to say the least. But be very aware and cautious if you're not knowing what's in the product, because it could catch you by surprise. Not only ruin, the atmosphere in that adult setting, you could end up by having someone take you to the hospital and having to deal with that issue.
One final thing from me, Mark, and it goes back to safety. If you're making your own, make sure they're properly labeled or unable to be obtained by someone who shouldn't have it, whether it's your kids or your pets at home. Because again, they tend to be in sweet type products that many people have an eye for, because, well, they taste good, and we don't want to have or you don't want to have that accident happen at your house or whatnot. So be mindful of that, so that they stay safe and they go to the people that it was intended for.
Mm-hmm. Yeah, very good point, Paul, for sure. Any other useful information at this point? And if not, maybe just kind of summarize, what you've covered, and then I'll do the same afterwards. Yeah.
Okay, so I'll summarize. We've touched on cannabis edibles as being, really two subcategories, if you will. The gel caps that almost appear pill-like, but they're set doses. So you'll have to find exactly how many you would need. One of the ways to do that is to start with cannabis oil and figure out how much you're using and apply that to the gel cap. If you go more the tasty food route, again, they're set doses as well. If you go that route, go to the government regulated or whoever in your jurisdiction is regulating those products, so you can ensure what's on the label is in the product, and dose yourself appropriately that way. If you're making your own, Mark cautioned on some of the intricacies with that. That being said, there is lots of information online that can help you, though we're not going to spend much time on that. Insofar as overconsumption goes, just be aware that because the cannabis edible is long-acting, you don't want to double up dosing because you haven't felt an effect within a certain amount of time, because it could be a really long day or long evening for you. And so the first time, especially if you're new to it, just take your time, start low and go slow, what we always say. And finally, just safe storage and safe care of your cannabis products, especially food products that look appetizing to anyone around, whether it's kids or pets, and just be safe. We want everyone to stay safe, just so the product is used, as I said, for who it's intended for.
Mm-hmm. Very good, Paul. Thank you for that. I'd just like to add that, especially for someone who might be cannabis naive, so not a whole lot of experience in going to an adult use setting, if you do feel where you've consumed too much at some point, is to try to stay calm. That effect may just promote anxiety and that sort of thing, and you're just aggravating the whole thing, and probably easier said than done if you are in that situation. But I just want to throw this out there, is try your best. If it's not for you, if it's someone that's in your presence, just to keep them calm. It will pass. Reassure them of that it will pass. And of course, if there's a need because of the way the consumer is responding, then of course going to the hospital would be the wise thing to do as well.
Excellent.
So, Paul, anything else before we go to our sign off here?
I think we're at sign off time, Mark. Thank you.
All right. So in closing here, I'd like to just ensure that while I wrap up in disclosure, I'd like to remind our audience that these information sessions are intended for individuals who are in generally good health, are generally well-adjusted, are functioning effectively, and are not in need of medical treatment, including mental health disorders. So these information sessions do not involve the diagnosis of treatment of any medical or mental disorders, and does not prevent, cure, or treat any mental disorders or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice of services of a medical professional. I want to underline, it is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option for you. And for those of you who have taken steps in improving your quality of life, congratulations. And remember that your journey is your journey. And as long as you are taking some steps forward in improving the quality of your life, you should be proud of the progress that you are making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of Paul and myself and our team behind the scenes, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I have also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.